Hi, I'm Allison Massey, registered dietitian and certified diabetes care and education specialist. Today, I wanted to talk about developing a sick day plan for those individuals that are living with diabetes. One of the things I often talk about, especially this time of year when lots of germs seem to be spreading all around, is having a sick day plan. You really should understand on days when you're not feeling well and you're not eating or drinking much, how you should adjust your diabetes medications. For those individuals that are taking insulin or specific oral medications, talk to your healthcare provider on what you should do for a sick day plan on those days when you're not eating much. I always like to focus on what we can keep on hand in our pantry for those times when we're not feeling well. And I found a few items in the dollar store that can work great for sick days, and just make sure that you always have something on hand for handling the times when you're under the weather. So first up is keeping something to stay well hydrated. And I found this box of 100 tea bags. It's green tea at the Dollar Tree. So tea is a fantastic way to stay well hydrated. Also, of course, this is just regular tea, so it's unsweetened, so it's not going to elevate blood sugars. So sipping on tea is a fantastic way to kind of stay well hydrated, especially if you have the sniffles or you're feeling under the weather. And again, just be careful about added sweeteners here, but keep a box of tea on hand, and this was a very affordable option. Next up is actually having a beverage that has a little bit of carbohydrates. So at the Dollar Tree, they sell a 4-pack of these 100% Juicy Juice boxes, and these are great for individuals with diabetes for 2 reasons. So number one, if you're not eating much at all, you still need to have a little bit of carbohydrate spread throughout the day. And if you just can't tolerate eating a larger meal, having a small juice box like this gives you something, and it also gives you hydration. So each one of these is 15 grams of carbohydrate, which again is a single serving of carb. So having these for those times when you're not feeling well, with a piece of toast and a scrambled egg might actually help with balancing blood sugars. Typically, we're not recommending drinking juice day to day, but if you have low blood sugar under 70, these are also perfect for treating low blood sugars. So juice works fast to raise blood sugar. If you are hypoglycemic, or again, that blood sugar under 70, these are perfectly portioned to treat low blood sugar. So they're 15 grams of carb, which is what we recommend. You don't have to worry about over pouring juice from a bigger bottle. And so keeping these in the pantry, or they're small enough you could throw them in a sports bag if you're on the go, are great to have on hand. Next up is my low sodium chicken broth. So found this at the Dollar Tree as well. Chicken broth is actually great to keep on hand for when you're under the weather, or just to throw together like a really quick, healthy, pantry-based vegetable soup, which I'm going to show you how to do in another episode. But again, this has a little bit of sodium, and it's very low in carbohydrates, obviously, not much protein. So you're not getting a lot of nutrition in this chicken broth, but whether you're gonna throw together like a quick soup or just sip on the broth if you're feeling under the weather, this gives you a little bit of something to hydrate well. Next up, you see Jell-O here. So I love for my patients that enjoy Jell-O to actually keep a regular box or 2 of Jell-O for those times when they're not feeling well. So again, the purpose of this is when you're not eating much, you're getting a little bit of carbohydrate, and because Jell-O is made with water, it's also a way to hydrate. Normally, and or if blood sugars are running really high, we prefer the sugar-free Jell-O options, but this is quick and easy way to kind of get a little something in when you're not feeling up to, eating a big meal. And we just want you to kind of have a little bit of carbohydrates and hydration spread throughout the day. Last but not least, you can see I have some fruit cups here, which are, perfectly portioned. All of these are fairly low in carbohydrates. I have some mandarin oranges and some pineapple tidbits. So nice to have on hand and keep in the pantry, for those times when you just want something light and you're not feeling your best. And last but not least, having some type of cracker or a dry, low sugar added dry cereal to kind of snack on, again, when you're not feeling well is great. So these are good pantry staples to keep for a sick day meal plan. And certainly, again, make sure the next time you talk to your healthcare provider that you do talk about, what do I do on sick days? You know, how do I handle my diabetes medications? Hopefully you have, you know, a plan for the food and keeping a small area of your pantry reserved for those times when you don't really want to leave the house because you're not feeling well, but you need to have a few things on hand. I hope that helps in terms of developing a diabetes sick day meal plan.